what's ended up happening is that there's very few intensive programs out there for anything brain related. And when I say intensive, patients come to our clinic. They are here 7 hours a day, usually for 2 weeks, with a weekend break in the middle. So that's 10 days of, and you get an hour lunch break in the middle. So it's really 6 hours of therapy, Monday through Friday, week one, 6 hours a day therapy, Monday through Friday, week two. And so you're getting 60 hours in 2 weeks of therapy. Now, some of that has to be brain breaks because you just can't be active and engaged the whole time. But they're very targeted brain breaks to try to get the brain to reset, rest, and recover so it can handle the next challenge, and we kind of cycle through that. But patients will typically come in with a myriad of symptoms. Hey, I hit my head. I have all these symptoms. And we do a free consultation. So we really want people to first be educated and learn what their options are. And sometimes it's not post-concussion syndrome. I send them somewhere else, so I think it's a great free service. If anyone's having symptoms, hey, come in, let's talk about it. Let's see if we think what you've got is what we can help. So that's the first step. And then if it is post-concussion syndrome or a stroke or we've actually been working with depression and anxiety and a lot of other things too, where they haven't had any success with other methods. Then we'll say, okay, you're appropriate for our program. Let's set it up. And they come in. Usually it's for 2 weeks. And they'll start at like 9 in the morning, 4 in the afternoon. Most of what they do is on their feet, engaged with activities that are multisensory integration activities that involve multiple areas of their brain, getting them all to work at the same time. And so they'll be, doing something with balance or motor planning, moving their body while we're maybe throwing a ball. So they have to visually, track the ball. Maybe they're crossing their body. So right to left, we throw it to the left side. They catch it with their right hand and vice versa. So we get a lot of cross-hemispheric activation is what we call it. We want both hemispheres to really engage simultaneously as well. And then we start that session, I forgot to mention, with cardio. So we want to get fresh blood to the brain first in a natural way. Cardio is the best way to get it naturally there. And so we get there, it brings a lot of fresh oxygen, which a lot of neuro connections require that increased oxygen. You're really priming the brain to learn and to make connections. And then we'll do all these multisensory activities. That's about an hour and 15 minutes of engaging the brain, trying to make areas that are less active engage again.
Thanks for watching this video, and don't forget to like and subscribe to the channel.